Hi, I'm Mack Margetts with the 2013-2014 Year 1 Nurses Council. I'm here today with Dr. Eloise Carr. Dr. Carr, could you just give us a little introduction about yourself?
Thank you, Mack, and thank you for inviting me to participate in the project. I am a full professor. I arrived from the university of Bournemouth in the UK a couple of years ago, actually, and I've been really delighted to come to Calgary in the Faculty of Nursing, and in particular to sort of regrow and stimulate my research programme around pain management, and obviously have the fabulous experience of working at a Canadian university.
Awesome. So as a professor, what kind of courses do you teach with the Faculty of Nursing?
Well, since I've arrived, I've actually been teaching. I've moved through several different courses. I've taught on the graduate programme, and I'm still teaching on the graduate programme quantitative methods. I've taught nursing, substantial theory, and I'm involved in the leadership course at the moment. And I've also taught on the undergraduate programme as well around evidence-based practice and trying to get undergraduates excited about research.
Absolutely. So as a researcher, what do you look at with your chronic pain research? Is there any particular subject group that you address?
Well, chronic pains, I always usually start out when people talk about research and ask me what I'm interested in, saying if it's to do with pain, then I'm not Catholic. You know, I will, I'll move into any area, sort of within reason. I guess basic science isn't my area of expertise. But I'm very interested in patients' experiences around chronic pain, very interested in service development, how we better meet their needs. And that sort of piece of research that sits at the end, as sort of the implementation science, if you like. How do we get the research findings into practice and innovative ways of doing that? Knowledge translation is a sort of more formal term, but some of the evaluation research that I do takes us into practice development and change. So.
Oh wow, so do you integrate any of your research into your teaching or any of the programs offered here?
I like to, and if there's any opportunity to draw on my own experiences, for instance teaching the Masters in Nursing at the moment, a lot of my work's been around advanced practice for nurses. So I can draw examples of the practice development areas where nurses have really extended their roles and sort of made a difference to patient care. So I can bring that from my pain research area, which is often nice.
Wow, that's really cool. So as a researcher, do you have any projects going on at the moment with chronic pain?
Well, chronic pain is one area that I'm interested in. We're just about to hopefully start looking at a project with chronic pain patients and exploring whether they would be interested in having an intervention around loss, sort of associated to grief, but whilst they're waiting to see the chronic pain programme team, they often are on a wait list without any interventions, and we have a sense that they may be receptive to a loss intervention which could improve their quality of life. So there's one project just about, hopefully, to start in the next few months. We're finishing up a project sort of quite differently, looking at leaders in pain, particularly education across the UK, across Canada and America, who have been absolutely instrumental in making a big contribution, and we would like to find what got them interested in pain in the beginning. So we've just analysed that project and moving into publications, and it's interesting how that, you know, when we look at improving care for pain, we need champions. So if we can learn from how they became interested and became such vanguards for change, then hopefully we can draw that and start earlier with our undergraduates and getting them excited about pain and helping to support them.
Absolutely. So do you, there's a program at the UC right now, it's the undergraduate research program. Do you take on any interns during the summertime, any undergraduate researchers?
Last year I had, it was sort of a little bit of serendipity. I think one of my colleagues mentioned about my interest in pain in her class, and I had a few students come in the summer and say, can I come and, you know, work with you or look at, you know, projects with you. And one student was successful in applying for CIHR studentship, And this year I have another student looking to apply for a Pure Award. But my door's always open for a conversation. There's always work going on, whether it's the beginning and the ideas, or whether it's some data collection, or whether it's colleagues I know who have other projects going on that I might be involved with as a collaborator as well. So I think there's always room for conversations, and students in particular.
Excellent. Well, thank you very much for your time today. It's been a pleasure.
Thank you. Thank you for inviting me.
Absolutely.